Welcome. Welcome to forpay.org, Consumers Dr. Vengala. Guys, I want to talk about myself. As a physician, I had the most gratification of taking care of my patients. I love it. My patients adore me, except few of them, of course. I can't make everybody happy. But the days when I started my practice in healthcare in 1980s, I love taking care of my patients. And most of my patients love me. They adore me. They talk about, he's such a nice doctor. And also, this is, folks, this is in 1980s, mid 1980s. I used to make house calls. People, when I started my practice, my gratification was taking care of the patients. When people had problems, I used to go and make house calls. I never billed them, of course. I just, as a courtesy. It's not for, I feel like people were helpless when they're at age, they couldn't, being a urologist, you know what I'm talking about, being not able to pee, having some problems, having catheter issues. I used to go and take care of them. I remember the days I used to do that quite often, till one day somebody told me, man, you're exposing you to liability. So more and more I came to what I just backed off, but I love to take care of the patients of mine. As I said, few people, once this stupid managed care came in, man, the relationship is not the same, doctor-patient relationship. It has changed. It has changed. People, I had my own practice, and also I was working for a medical group. The medical groups are all under the so-called managed care. Yes, the managed care. They're complainers, folks. These people are unhappy with their health insurance, unhappy with the service, unhappy with everything. They're complainers. Managed care is nothing but complainers. Whereas in my private practice, I had no issues. One lady went and complained, to the medical board, oh, this doctor didn't do this, didn't do that. You know how this stupid California medical board, they don't give a damn. They just say, okay, time to retire. That's what I did. That's the best decision I ever made. That's the best thing I've ever done. You know what? California Medical Board lost a physician. I didn't lose them. They lost me. I believe, I'm a good doctor. I really believe I'm a good doctor. I'm taking care of, I get my gratification. Now I'm serving the people, providing advice to the people who need the most help, because this health insurance is a scam, man. Health insurance itself is a scam. I believe we need a disruption in the insurance sector, health insurance sector. Hopefully, forpay.org will be a disruptor, folks. What I would like to see is it has to be consumer-driven insurance. How many of you have seen consumer-driven insurance, folks? Not many. Only thing they know how to collect money from you guys, but they never tell you, okay, give this premium, you will have this much deductible, we'll start some type of a savings account for you, so you can pay that deductible from your own savings. So it needs to be consumer driven, folks. Insurance needs to be consumer driven, and the insurance sector is not consumer driven. That needs to be disrupted, folks. That needs to change. It doesn't matter, home insurance, auto insurance, it doesn't matter. All these things, if a minor thing, but how many times have you noticed, okay, we'll start your savings account. So if you do this, you'll save this much. If you do this, you'll save this. I wish insurance companies did that. Well, time has come for the insurance companies to be disrupted. It needs to change. You have to have insurance, but at the same time, it needs to serve the consumer. Not the company, consumer. I was listening to Jeff Bezos. You need to have a calling. You need to have a calling. And he was so fixated on the consumer. Look at where he is. As long as you're serving the consumer, there are no limits, folks. Serve the consumer. If insurance companies are watching, serve the consumer, not company. You'll come out a lot faster. And look at Amazon, look at companies which serve the consumers. That's where we need to focus on consumers. I'd love to see that happen, folks. Well, if you like this channel, subscribe, share, and just follow me, folks. I'll continue to talk about health insurance, health care, and hit that like button, subscribe, share. We will see you in the next episode. Goodbye. God bless.